The possible complications from the brow lift vary tremendously depending again on the surgeon, technique, and particular patient. Please review the complications in the facelift segment as they are very similar to those with brow lifts.
To follow a patient through the surgical experience of a brow lift, please refer to the facelift segment of this video. The before and after pictures shown were of patients who had a brow lift performed in addition to their facelift. The patient videotaped in that segment also had a brow lift procedure performed. Her preoperative and recovery process can be followed. Here are some before and after photos of a patient who had an endoscopic brow lift performed. He also had a deep plane facelift and his upper and lower eyelids done. In the after pictures, you can see that a refreshed and pleasant appearance has been obtained by conservatively lifting his brows. The after photos were taken 6 months after his procedure.
Many patients are interested in how they are going to look during the healing process. This is especially important for men who do not feel comfortable wearing concealing makeup and usually have shorter hair lengths. These photos were taken 1 week after his surgery. Keep in mind that he also had a facelift and upper and lower eyelid surgery. You can follow each surgical area of interest to see changes during the healing process. Bruising, swelling, and suture lines are all visible, and patients are generally not presentable. Although healing varies, usually by 10 days to 2 weeks, patients are able to be in public view. This is a photo taken 3 weeks after the surgery. Suture lines around the ears are difficult to see but are still visible on close inspection. Careful placement makes them less noticeable. This photo is 3 months after surgery. It is important to note that after a surgical procedure, there is always swelling. This occurs with any surgery, including chemical peels, laser resurfacing, and dermabrasion. In the early postoperative period, the swelling makes the wrinkles look more improved than they really will be. No matter how hard your surgeon pulls, there will always be stretch back or loosening of the skin as you continue to smile, laugh, and chew your food. This will always cause some relapse of the initial problems and some return of excess skin or wrinkles. Although unavoidable, this is a welcomed process. It allows for a much more natural end result that is much more valuable. In the photograph of this patient prior to his operation, you can see that his brow is low and his eyes appear small and tired. Facial animation creates unique expression lines that our friends and family recognize. This photo taken 6 months after the procedure shows that this patient was able to maintain these unique features that enabled him to still look like himself. At this time, visible evidence of surgery should be absent to the most critical eye.